We're going to start with John Santa, who is our Director of Dissemination.
Hey, thanks, Kate. And thanks to all of you for coming today. It's really terrific to see the interest in OpenNotes. And as Kate has, I think, made a bit of a case for, we think we're getting to the tipping point where implementing OpenNotes is becoming the thing to do. And we're thrilled by that. But we're also challenged by the topic we're going to talk about today. Next slide. I like to start all of my conversations now by putting the folks who are most important first, and that's patients and families. And in many cases, I think this is a clear-cut decision for organizations. Do we put what patients want and need first, or do we slow things down because of the anxiety of our clinicians? And so we're really talking about those two things today. Next slide. I love this slide. It's from wonderful Liz Salmi, and with her permission, we can see an after-visit summary on the left and a note. And what more can you say about the difference between the two? For the person who wants to know, as Liz says in such a lovely way, I'm a curious person. And I want to know about what's going on with me and my health and my life. It's a pretty stark comparison in terms of the information between an after-visit summary and a note. Next slide. So we began to think about should we look deeper at what's going on a couple of years ago. We did so because we were interested in confirming the research findings that in the sites where the research was done had pretty high note opening rates. We also began, as we traveled around the country and ran into patients, and sometimes doctors, sometimes health policy folks, who we knew were at organizations that shared notes. We would ask them if they had looked at their notes, and they would look at us in a puzzled way and say, no one told me I could see notes, and sometimes we would even be able to take them to a terminal and show them their notes, because some of them would say, yes, I've heard about that, but I have no idea how to find my notes. And now, quite honestly, we've had to be a little bit more sensitive to a word or two words we use frequently, which is non-event. Many of our implementations have been described as, this was a non-event. Not much happened here. Well, sad to say, in some cases, it may be a non-event because not much is happening. Patients aren't aware that they can see their notes or they can't find their notes. Now, I want to assure you that we know of many, many robust implementations where we know that tens of thousands of patients are seeing their notes. And those organizations can feel the benefits. Ultimately, for OpenNotes to lead to what we think is its best outcomes, we need to take steps to maximize the benefits and minimize the risks. Next slide. So we began to look at qualitative data that we had from Kate mentioned earlier that we asked organizations to document their implementation, and we asked a variety of questions. So we began to look at that data and ask ourselves, could we predict which implementations were most likely to be effective? And when they also provided us with portal registration rates or a small sample of note opening rates, we could see, gosh, some of the implementations we thought would be quite effective weren't. And some of the chief medical information officers and others started to share with us what's going on here. So the first thing we did is we focused on communication efforts and began to try and get a sense of who was doing a lot of communication and who was not doing much at all. And we could see that only seemed to have a modest impact. Well, then we went back to several organizations and 80-some organizations and asked them specifically, would you share a note opening rate with us as defined in the slide there. So we're focusing on notes that are in the portal and what % of those notes are being opened. And so EPIC organizations, as you can see on this slide, were able to measure that, though only a minority were. Many EPIC organizations responded that, that's not something we measure. It's not on our dashboard now. We really can't provide that data to you. But eventually we were able to collect information from 26 organizations. And frankly, we were pretty stunned by the results. As you can see, results fell in 3 tiers. We had 4 organizations, 2 of which were homegrown systems, who were in the best performing tier with notes being opened between 21 and 34%. We had a middle tier in which notes were being opened by 6 to 10% of notes. And then we had a bottom tier, and it got quite low, as you can see, where really only a tiny fraction of patients were opening those notes. We set about trying to sort this issue out. We've just released a white paper called Implementing Open Notes, Improving Access to Notes on Patient Portals. It's up on our website. All of you as attendees or registrants have gotten an email or should have gotten an email with a link. So we would urge you to take a look at that. Our hope is that this starts an important conversation about how to get to effective implementation. Next slide. Now, some of this is a vendor issue. We have a very good relationship with Cerner, and Cerner does a wonderful job of supporting open notes. But in terms of measurements are more driven by their customers and Google Analytics, and Cerner folks were not able to generate a note opening rate for us. Could you go back, Amanda? Move back. Yeah, thank you. In talking to them, though, from the data that they were able to generate, we could see there were some very significant differences. In some Cerner organizations, a few thousand folks a month would be downloading notes. In others, tens of thousands were downloading or viewing notes. And when we talked to Cerner patients on Cerner systems, some of them reported, my gosh, I go into the portal and I click on a box that says Open Notes and I can see my notes, while others describe pretty tortuous navigation routes to their notes. In terms of Allscripts and Meditech, notes there are put in a file along with a number of other documents, and so right now they're impossible to measure separately. So we weren't able to get measurements from any Allscripts or Meditech customers. Epic has worked with us very productively. And as they began to see this data, they've launched multiple near and now long-term changes to optimize note opening rates, and I think we're beginning to see some of those results. They've also standardized the note opening rate and included this metric in their recent versions. So many Epic customers can now see this metric on their dashboard and don't have to do any additional work to see this. We've appreciated how Epic has worked along with us in terms of these issues. Next slide. We think that ease of navigation is a very significant, if not crucial, factor. Not surprisingly, fewer clicks probably translate into higher note opening rates. We also think communication efforts are crucial, but so far they've been modest impact. Reminders we think are especially powerful, but we're also getting the sense that the details may matter in terms of how those reminders are structured, delivered, etc. And we're also now getting reports from some sites who have made phone access available, mobile phone access, and that looks like a significant number of folks will come in and look at their notes via their phones that perhaps didn't on their desktops. We are going to be distributing the white paper on effective implementations to all implementers and other interested parties. We feel free to circulate it. We hope this stirs a productive and constructive conversation. We are working on effective implementation measurement, and I think that's the key thing. As you all know, you can't improve what you don't measure, and the first thing you have to do is arrive at a measurement that goes across vendors and organizations, et cetera, and we're especially interested in doing so with folks who have Cerner and with Cerner itself. We are working with other outside organizations that are interested in this topic, and there's several. And we'll be following up with implementers to identify their best strategy. I want to mention especially that Epic is presenting a national webinar for Epic customers on this topic. A date hasn't been set, but if you email Deb Wackenheim, we will get an invitation to you. This is, again, for Epic customers. Next slide. So this is what I hope you take home. Just a nice and wonderful and pretty illustration, thanks to our folks at the OpenNotes team. Easier portal navigation plus patient communication looks like it results in higher note opening rates, and this is the start of really improving the effectiveness of implementations. Thanks to all of you, and now I'll turn it over to Kate for questions.